Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. It is 9 o'clock on Friday, and you are watching me, Deb Burton, Executive Director of RI Elder Info, the nonprofit that every week brings you information that you or someone you know needs to know about. And I strongly encourage you to hit the like, the share, the bells, the whistles on today's conversation, because the topic has been hot in the news, and I need to provide some clarity for folks around what is Medicare and Medicaid and what's the difference and why does it even matter. So there's going to be a lot of people impacted by this conversation, so please make sure that you share this video out. Now, as you know, as a nonprofit, could not do this without the support of our sponsors and our donors. So a huge thank you to Point 32 Health Foundation, United Healthcare, Oak Street Health, and especially to McCarthy Law, our sponsor for Friday Friends. Here's a message from McCarthy Law.
Here at McCarthy Law, we practice in the areas of estate planning, long-term care planning, elder care law, and residential real estate. Our focus is really on providing peace of mind to our clients.
If you're interested in scheduling a consultation with our office, you can feel free to reach out to us at 401-541-5540. You can also reach out via website at www.mccarthylawri.com. You also should check out our social media, both on Facebook, Instagram, and LinkedIn for some helpful tips and tricks.
Well, everybody, there has been a lot in the news this week about the Medicare program and the Medicaid program, and eligibility, funding, increased utilization, all of these kind of high-level conversations that I really wanted to take some time to break it down to why this matters to everyday folks like you and I. So for those who may not be aware, Medicare, we care for our elderly and our disabled. So Medicare is a program that, assuming that you have paid in enough quarters throughout the year, across your lifetime, you'll be eligible for Medicare. Okay. Medicare has several different parts. The first part, Medicare Part A, okay, is your traditional Medicare. When you think of Medicare Part A, I like to think of it as like Medicare A. Hey, it really hurts. Oh my gosh, I really have to go to the hospital. Oh, I'm really, really sick. My arm is really broken. Medicare Part A covers your hospital stays. Okay, but then there's Medicare Part B. Okay, Medicare Part B is for, boy, I don't feel so good. I got to go to my doctor. Medicare B covers your doctor's visits. Okay. Now there's also Medicare D. D is for drugs, and that is the program through Medicare that covers your prescriptions. So when you hear about changes in, say, fixed pricing for insulin or lower costs on certain drugs, they're under Medicare. That's under the traditional Medicare Part D drugs. Now, you'll notice I talked about A, B, and D. Medicare Part C could be a choice for you. Medicare Part C is an Advantage plan that can cover Medicare Part A, Part B, and D all together. It is offered through private insurance companies, okay? And it is something that works for many people. Those are the ones that you often see advertised. So that is Medicare. And there is a cost to Medicare, and it is usually deducted automatically out of your Social Security check, or can be deducted automatically out of your Social Security check. If you're not sure what Medicare plan, your traditional Medicare A, B, and D, or a Medicare Part C Advantage plan is right for you with your medical conditions, the doctors that you see, and the medications you're on, you can call the point at 401 462 4444 and speak to what is called a SHIP counselor or a Senior Health Insurance Patrol counselor. And they can go over all of your information to make sure that you have the insurance plan that best meets your needs. Now, we do have open enrollment finishing up soon, so you want to call the point sooner rather than later to make sure that you have a product that works best for you. Okay. When we're talking about privatizing Medicare and those kinds of things come up at the federal level, it's the difference between your traditional Medicare Part A and B and D and what the government will cover in relation to the Medicare Advantage plans, what insurance companies that are contracted with the government to provide to you. So it's really important to understand the difference between your traditional Medicare and your Medicare Advantage plan. And again, what works best for you is what works best for you. Okay. So the other topic that came up is Medicaid. And there have been comments about the increase in individuals utilizing Medicaid. So Medicaid, we aid our poor. Okay. It is income and asset based. So it depends on what you have in the bank and what you have in property. And if you're not sure, you can see the information on the RA Elder Info website under Paying for Care. And we can pop that on the screen so that you know what the link is, and we can also have that in the comments. Now, here in Rhode Island, in Medicaid, presently, your assets need to be under $4,000, your liquid assets. Okay, so that's your cash, your checking, your savings, the cash value of your life insurance policy. And your income also has a maximum amount. Now, depending on what kind of services you need, the actual asset and income tests may vary a tiny bit. So here's the thing that we need to think about when it comes to our aging space. Medicare, the one everybody gets, does not cover long-term care. So if you need a nursing assistant to come out and help you bathe and dress at home over a long period of time, that's considered long-term care. If you need to go to an assisted living facility or a nursing home, those things are called long-term care. Medicare does not cover long-term care. Now you're saying, but wait, Deb, Medicare did cover when my loved one, so-and-so friend went to the nursing home. Here's where it gets a little tricky and confusing for folks. If you have a qualifying hospital stay, so you're really sick, so you go to the hospital, generally you are there for 3 midnights admitted, head in the bed, okay? And upon discharge, you need what is called skilled care, which is the highest level of care in order to get back to your baseline of where you were before you fell. Okay. Then you will have Medicare cover your visit to the rehab side of a nursing home so that you can be rehabilitated back to the point that you were before the incident happened or until you plateau. So let me give that to you in a real life kind of example. You fall, statistical probability, you will break your hip. It's not a stereotype, that's just a numbers that you land on areas that are covered by your hip. You go in, you have a hip replacement, and now you need some rehab to be able to get up and walk again. Okay, great. You go to the rehab facility. Now, having spent some time in the hospital, you're probably not sleeping very good. And so you get to a new facility and you're like, oh, I'm so tired. And physical therapy comes in, it's like, come on, let's go. We got to get you up and walking. And you're like, everything hurts. I haven't slept. No, I can't do it. Okay. And then the second day comes and you're like, oh, everything is so stiff. I can't get up. Physical therapy is like, we've come twice. Okay. And then the third day comes along and you say, okay, I'm going to get up and get going and everything kind of hurts. And you participate in physical therapy and occupational therapy and all of those things, but you reach a wall where you're not progressing anymore. Well, now Medicare is saying, you've achieved as much as you can. That's all we're going to cover as far as your insurance is concerned. Now, I know you're watching and you're thinking, oh, the 100 days. We've been told Medicare covers 100 days. While technically accurate, Medicare covering 100 days of therapy assumes that across those 100 days that you have continued to make progress. And at day 21, depending on your Medicare plan, you will encounter a daily copay, and that can be a couple $100s a day. So many people find that their rehab ends right around day 20 or earlier. But just like, oh, wait a minute. If I broke my hip and I'm not successful in rehabbing, how am I getting upstairs to go to my bedroom? How am I getting downstairs to the bathroom? Oh, that's not actually Medicare's problem. That becomes your problem. And when it becomes your problem, it's not necessarily that the facility is going to say, you can't stay. Their question most likely will be, how will you pay for staying? Or if you need to go home and you need to have a CNA come in every day to now help you bathe and dress, the question is going to be, how will you pay for that? And this is where understanding Medicaid gets really important. On average, so high, low, divide by 2, average, nursing homes are going to cost about $15,000 per month. Some are a little higher, some are a little lower. Okay, so at $15,000 a month, when you max out your rehab and you've gone as far as you can, and you're finding that you need more help than what you're able to do at home. Now you need to figure out how are you going to pay the $15,000. That's $180,000 a year, right? Most people, not all, most people don't have that kind of money laying around to be able to pay privately for their care. So then the question is, okay, now what? And this is where understanding Medicaid gets really important, because knowing what you have in the bank and what your assets are in order to use those assets to pay for your care becomes really critical. Medicaid will cover long-term care if you qualify for Medicaid. Now, we've had some great conversations across our Friday Friends about what is involved in qualifying for Medicaid, what documents are involved, all of those things. So please look back. Check out some of our conversations with McCarthy Law and the Department of Human Services and the Office of Healthy Aging over the period of time, and you can see what's involved in qualifying for Rhode Island Medicaid. Now, perhaps you're the one who is coordinating care for a loved one in another state. And you say, well, that's not actually what happened in my loved one in Massachusetts situation, or Connecticut, or Iowa, or Texas. That's because Medicaid is determined, eligibility is determined by each state. So you may be eligible in one state and not eligible in another state. It is governed by the residence that you live, where you live. So you have to be a Rhode Island resident to qualify for Rhode Island Medicaid. You're not going to take Rhode Island Medicaid and go to your house in Florida and have the Medicaid cover you in a long-term care facility in Florida. So it's really important that you understand what it takes to qualify for Medicaid when you need care. So again, Medicare is based on age and disability. There are multiple parts to it. Not only is there the straightforward Medicare through the federal government, but there are also Medicare Part C that are the Advantage plans, that it's really important that you understand what works best for you. And if you're not sure, you can give the point a call at the 401-462-4444 number and speak with a SHIP counselor to make sure that the plan you have is right for you. But understand the Medicare plan that you get is not going to cover long-term care. And so it becomes really important that you plan ahead when you are looking at the future and possibly needing long-term care. How will you pay for it? And there's definitely ways that you can meet with an elder law attorney and discuss your options if you have assets and resources and things like that. But you want to have that conversation before the fall. You want to take a look at your financial options before a crisis. As much as we like to think that we won't need care, the statistical probability as we get older is that we are going to need care. And so when I hear testimony that the Medicaid program is growing in the number of people it serves, yeah, I can believe that. Because as we are getting older, we do need more care. It's just the statistical probability, okay? And so we have to think about, how is that going to be paid? So it's important that we pay attention to what's going on in Washington when they talk about Medicare, when they talk about Medicaid, because it is something that is very likely to impact you or someone you know as we age. It's important that we have these conversations and think these things through as to how we're going to cover the cost of the care that we need before the crisis. And it is especially important that our leaders in Washington understand the fundamental differences between Medicare and Medicaid. So I am glad that you have all joined me this week. If you have questions, please visit the raelderinfo.com website and look for Paying for Care under Health and Support so that you can see the different ways you can pay for the care that you need, as well as an outline of the documents that you need to gather. If you do need to apply for Medicaid, you can get those ahead of time. I'm glad you've all stuck with me through this very lengthy explanation of a very heavy topic. I look forward to seeing you all again next week. In the meantime, be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.